Welcome back. Thank you so much for staying with Morning Live. And of course, your responses to our question of the day, which relates to vaping. Now, the World Health Organization has called for strong regulation to reduce the appeal of electronic cigarettes in order to protect children and non-smokers and also to minimize health harms caused by smoking. Now, the organization says that action should also be taken in conjunction with measures to motivate and assist existing users of tobacco products to quit tobacco use by using proven methods, including healthcare workers and toll-free quit lines. So this follows the increasing and widespread use of vaping by underage children globally. To talk to us more about the impact of children using electronic cigarettes, we are joined virtually by Kurt Yeo, who is a co-founder of Vaping Saved My Life, as well as Professor Lekan Ayo-Yusuf, who is a director of the National Council Against Smoking and the Africa Center for Tobacco Industry Monitoring and Policy Research. Professor Kurt, thanks to both of you for joining us this morning. And Professor, if I can just start with you. The World Health Organization has called for action on the use of electronic cigarette use by children worldwide. But how concerning is the situation in South Africa?
Thank you very much. The situation in South Africa is quite concerning, and more than anywhere else in Africa, South Africa seems to be an epicenter of a growing epidemic of e-cigarette use among children. The study from UCT looked at a number of high school children, and that's shown that this is quite rampant. And we've also we've been monitoring for the last 10 years national surveys that included young people, 16 to 34. And we've seen a tenfold increase in the use from about 0.4% to 4.1%. Importantly, these are often young people that are not necessarily smoking as well, but most of the time, even when they smoke, these are people who use e-cigarette occasionally, perhaps just for situational use over a weekend or for fashion. So it is concerning, and we estimate currently in South Africa about 1 million e-cigarette users. About 300,000 of them are below the age of 24, between 16 and 24. So it is a big concern.
Is there any further light shed on that, Professor, in this research? Is the public perhaps being misled about the safety? Are there perhaps deceptive claims, false claims on the safety and efficacy for quitting cigarettes by taking on or using e-cigarettes, perhaps?
Yeah, because I've been doing tobacco research for the last 25 years in South Africa. And 13 years of that, I was running cessation clinic. I ran randomized trials, helping TB patients to quit smoking in primary care clinics. So we pretty much know what works, both in counseling patients, where we achieve about 22% quit rate beyond 6 months. So e-cigarettes came to South Africa on the notion that it could help smokers to quit. Indeed, a very novel idea. But what we've found is that we looked at about 18,000 in the real world, as you can see from the WHO report. When you do an experimental condition, like we've done in clinical trials, where you actually have people follow a particular pattern to tell them to quit, give them counseling, and give them e-cigarette, studies have shown that you may get 3 more people out of 100 to quit compared to if they didn't have e-cigarette or they didn't have nicotine replacement therapy, which is the medicated or the approved version. However, when you go to real world, the studies have shown that e-cigarette does not help. And we've also done the same observation in South Africa with a lot of people, over 2,000 e-cigarette users. What happens is that they were able to quit by 6 months, they relapse. 65% compared to 53% of those who did not use e-cigarettes. So indeed, e-cigarette helps some people. But what we're saying is that on the other side of it, if you have 3 people more quitting and you have 4 young people starting, the net public gain or the net public benefit, the net public health effect is harmful to the population. So all we're saying is I do not support banning e-cigarettes. What I'm saying is it should be regulated, because the reason why young people are picking up this habit is because it's not regulated. The advertisement is all over. The flavors are all over. You do not need all of that to help people to quit. So you need to regulate e-cigarettes. And this is the problem in South Africa. They are not regulated. I can tell you, was a Cotton First Festival last year. We had young people, e-cigarette abuse was in the background, and this young lady carries a few packs of cigarettes around her neck to advertise, together with e-cigarette in the background. So we actually see dual use promoting people, young people, to get into the cigarette. Since the tobacco industry bought the e-cigarette market, e-cigarette company, I think it was 2019, the situation has become really worse. The adverts have become more aggressive. The flavors, the nicotine, nic salt have come into e-cigarette. So the situation is really, really bad without regulation, and everybody knows this.
All right, Kurt, let me bring you in, listening to what the professor had to say, the World Health Organization saying that the promotion of e-cigarettes has led to a marked increase in use by children and adolescents, with rates exceeding adult use in some countries. So are you concerned about this particular aspect?
I am concerned. I'm concerned not only because I believe and strongly believe that vaping or e-cigarettes do help adult smokers quit, or at least practice harm reduction, but as a father and of a 14-year-old son, is that I agree with what Prof is saying, is that e-cigarettes need to be regulated. And it's been in a regulatory holding pattern since 2018. But unfortunately, we've been sitting on our hands around this. Unfortunately, the bill that has been presented to us is going to face an enormous amount of challenge because it is rather draconian. And I have to agree, is that no one wants to see people under the age of 18 using any form of nicotine at any stage. But unfortunately, in South Africa, we don't have a vaping problem. We have a smoking and an illicit problem. Currently, we have over 2 million kids smoking cigarettes, whereas according to the global adult tobacco survey, which was conducted in 2021, only 3.1% of that same cohort was using e-cigarettes. At the same time, 23.9% was smoking cigarettes. And I agree that studies that was done by UCT, where it looked at vaping in the high school setting, is critical. It's important that we keep doing these studies, but we need to put context to that. That study was done on a very, very small, biased selection criteria. It selected quintile 5 schools. That kind of study needs to expand, and it needs to expand across all the spectrums. We need to understand the whole suite of issues around you and the complexity. So I agree, regulations have to happen. The damming down of marketing and advertising around e-cigarettes, the messaging is wrong. I agree 100%. But we also need to realize that this product is vital to helping people, adults, quit smoking or at least practice harm reduction. And we've seen this being adopted by places like UK and New Zealand. And in fact, in some cases, the UK is providing free vapes to people that want to quit smoking. And New Zealand actually have a website that promotes these things for people that want to quit smoking.
So just quickly on the policy side of issues, Kurt, you've mentioned, the word draconian with regard to some of the laws. You've said that the Department of Health and policymakers are actually failing to recognize the harm reduction tools like vaping, and that these could actually substantially reduce costs to the economy. How so?
Well, if we look at, for example, a lot of the rules, the regulations around that, we can't display the products. The product cannot be promoted through any form whatsoever. So me simply stating, for example, that Royal College of Physicians consider that vaping is 5% or carries less than 5% of the harm when compared to smoking could see me face jail time. So if a product, if we look at, for example, people using a product in their own home, could face up to jail time as well. And then we look at, for example, some of the stuff around the definition of the bill. I know a lot of people saying that this bill, for example, says that it's for indoor spaces. But if you look at the definition of the bill, it says enclosed space, enclosed areas. And when they define enclosed, it says anything that has a wall or a roof is considered enclosed. It's not about indoor. So we need to be very careful around this. So unfortunately, a lot of the bill doesn't take into consideration people that are smokers, people that need help. There's very little in the way of services and help in South Africa to help these individuals quit. We only have smoking cessation clinic in one place, and that's by Prof. Van Zyl-Smit in UCT. We don't have cessation counseling in our public health spaces. We don't even provide nicotine replacement therapy as an essential medicine to the public. So what is the outcome? Is that people are only relied on one thing and to quit, and that's to quit or die, cold turkey. And we know, based on the World Health Organization, that's an incredibly unsuccessful method of doing so. In fact, they've indicated it's only 4% of people are able to quit through that method. And if you look at, for example, the FDA in the United States, they say it can take up to 30 times. And I'm living proof of that. It took me 10 years to try and quit smoking, but it was only with the help of flavored nicotine vapes that I was able to quit smoking, and that was 10 years ago. So I've been vaping for 10 years, and I was smoking for 20 years.
Gentlemen, we're fast running out of time. So I just quickly want to speak to the harms, the dangers of vaping as opposed to smoking cigarettes at this stage. If we could just very briefly speak to that, Professor.
Maybe just quickly, it is important to put context. And I find it very interesting that Kurt will put a context to the study in UCT, but not put a context to the UK findings, because UK have controlled tobacco use much more than in South Africa, and therefore it might be easier. So because we don't have time, I'll be happy to engage Kurt to understand, having done the studies for more than 20 years, that we can explain exactly what's happening in South Africa. Getting back to the harm reduction, indeed, the University of Pretoria runs harm reduction clinics. Nobody would market methadone. The problem we have is that these products are not regulated. In fact, studies have shown that if you regulate them, put in vaping product in a plain package, so adults will still be able to use them, but it would dissuade young people. So all of the proposal in the law, in the bill, they are evidence-based. It's going to work. And South Africans have been quitting. So the health effect is lower than that of cigarette. But however, we do not have the full quantum until we actually see real human studies. Exposures data have shown they have lower exposure, but they are also exposed to new chemicals that we still need to check. For example, you might have flavors. When you heat flavors to 1,000 degrees Celsius, you create aldehyde, which are carcinogenic. So if you have kids using that for a very long time, it's a different trajectory that we need to study. We cannot expose all South Africans to this experiment. That's what we're saying. We say for smokers, great, but if it doesn't help smokers, not even 1 ounce of toxicant to any young person or even adult should be allowed. It's not harm reduction.
Interesting argument there. Just very quickly, Kurt, from your side, the selling of vaping products to underage children, that, of course, is of great concern. So how do you propose we work around that?
I think that's a very important part of the bill, the existing bill, and that should be part of the amendment that was done in 2008, is that any nicotine product should be prohibited from to the sale of anybody under the age of 18. I also believe that vape locations, or any location that wants to sell a vaping product or any nicotine product for that matter, should be licensed. But I think one of the most important things around all of this is the enforcement of laws. Because even if we look at the amendments that were made to the existing tobacco bill of 2008, cigarette sales was prohibited to anybody under the age of 18. It moved from under the age of 16 to under the age of 18. And at the same time, there was no advertising. It prohibited any advertising in the sale of tobacco products. But yet, we see that the product, or these smoking rates have elevated and escalated at this time. And it's actually a correlation to see how the illicit cigarette market and the smoking rates have increased, is because irrespective of what law you put into a country or into the system, if you're unable to enforce it, you then create a serious black market, an illicit market, which doesn't subscribe to any laws or any standards whatsoever. So again, we agree that regulations are important, but appropriate regulations and regulations that can be enforced.
All right. That's unfortunately where we have to leave it. Unfortunately, we are out of time. But thanks so much, both of you, for giving us both sides of this particular story, that argument, and our viewers will make up their minds. Kurt Yeo, who's the founder of Vaping Saved My Life, and Professor Lekan Ayo-Yusuf, Director of the National Council Against Smoking and the Africa Center for Tobacco Industry Monitoring and Policy Research, talking to us about the issue of underage vaping. And this, of course, has become a question of great concern.
All right.